Padres taking on the Phillies this weekend, and with reports of Fernando Tatis Jr.'s multiple shoulder subluxations this year, you may be wondering about your own risks and treatment options for this painful condition. Former Padres head team physician and current Scripps Clinic orthopedic surgeon, Dr. Heinz Hoenecke, is here to shed some lights on these injuries. Doctor, thanks so much for joining us here this morning.
Good morning.
Hey, we know you aren't treating Tatis and you can't speak specifically about his case, but having been the team's physician, you're very familiar with these shoulder subluxations. Let's start with what a subluxation is and how painful this is. I mean, we've seen Tatis Jr. just, kind of fall over in pain from these.
Right. And so, that's usually when somebody contacts another player or the ground and the arm, the ball of the socket comes out, the humerus comes out of the socket, usually all the way and then pops back in. A subluxation is a partially coming out. It's impossible to know if it comes out fully or partially during an episode, but that can tear the labrum, and then frequently in young people that doesn't heal, and they may have recurrent subluxations.
So someone that does have to go through this quite a bit, is surgery inevitable at some point?
If they've had a labral tear, it's a traumatic dislocation, and they've had a couple of subluxations like that, in order to really destabilize it, it's usually necessary. Physical therapy works more often for people that just have a loose joint. They may have very flexible joints, or it may be present on both shoulders. But in an athlete, especially somebody who's going to have contact, we usually end up fixing it, although football's taught us that we can do it usually after the season.
Yeah, I played hockey, and I had a lot of shoulder injuries in college. And boy, it's really tough to heal from because you're constantly using that shoulder. For baseball, in that swing, and hockey, there's checking, football, there's, the contact there. How do these athletes get beyond this throughout the course of a season?
Well, I mean, during the season, they try to strengthen as much as they can so they have control, but we try to make little changes as much as we can to reduce risk in order to, such as moving them from a high contact infield more into the outfield, or perhaps change the swing, try to keep both hands on the swing. For baseball. For football, their linemen, you might have them wear a brace. We have a rule for recreational athletes, too, that we try to tell them is that if you're at risk, try to keep your hand always in your sight. So when your hand goes out of your sight, if you can't see it in your visual field, that's maybe putting you at risk.
Oh, yeah, we saw that in some of the video with Tatis's swing there when his hands were out of his view. That's when that looked like it really was painful. Let's say someone like an athlete or even Tatis knows that they're going to need surgery, but they want to wait until after their sports season or just push it off. What can they be doing during that season to manage that instability until they actually go and get that surgery? Anything?
So they're going to work with the trainers and the therapists to try to keep all the muscles strong and coordinated so they maintain control, because when the muscles get tired or sore, such as after subluxation, they lose some of that control. So that's the reason for the period of being off, and to try to get all those muscles working so they have maximal control to keep the shoulder in the socket.
How long does a surgery, how long does a recovery from a surgery typically last on something like this?
Well, it depends a lot on if it's a throwing athlete, whether it's a throwing arm or not. If it's not the throwing arm, usually they can get back to swinging a bat in 3 or 4 months. If it's the throwing arm, it's going to be much longer because we have to wait for all the tissues to start to have their normal flexibility. And that takes quite a long time, for example, for a pitcher.
Yeah, sure, I can understand. When we're talking about multiple surgeries here, is that something that has to happen? Or when someone does get one surgery for a shoulder subluxation, is that usually good enough for an athlete's career, or have you seen before where you've had to do this multiple times?
Well, the great majority of the time, that's enough. One arthroscopic surgery is enough to fix it, but sometimes because they go back to the same risk and they have more subluxations, or they may have some combined loose shoulder, they may have had a couple of surgeries, and then we have to go to a more aggressive procedure like we're doing this morning on a patient, where we have to do a more aggressive open procedure to try to really stabilize that shoulder.
What could people be doing before they get out there and they do that contact? I'm assuming you got to really do a lot of stretching and slowly warm up and build up those shoulder muscles, right?
That's right, and it's a lot about technique too,
Yeah.
for their specific sport. And as you know, in hockey, it just comes out of the blue sometimes. You don't have a say in it.
Right. Dr. Hoenecke, thanks so much for your insight and your time here this morning. Really appreciate you shedding light on this.
Thank you.